Hi, my name is Joshua Galindo, and I'm doing my key learning reflection number 2 on using disciplined inquiry to drive improvements. By definition, improvement requires change. Unfortunately, change too often fails to bring improvement. Most of the time, leaders believe in the power of new reform proposals and are propelled forward by a sense of urgency. Leaders plunge headlong into large scale implementation. Invariably, outcomes fall short of expectation. Enthusiasm wanes, and the field moves on to the next idea without ever really understanding why the last one even failed. Such is the pattern of change in most organizations. Implement fast, learn slow, and burn goodwill as you go. It is impossible to predict all the ramifications that some planned change will cause to happen in an organization. All activity in improvement science is disciplined by three deceptively simple questions. 1. What specifically are we trying to accomplish? 2. What change might we introduce and why? And 3. How will we know that a change is actually an improvement? The first two questions are central to the causal system analysis and the development of a working theory of improvement. The third question underpins the design of practical measurement systems. These three questions together scaffold a learning dynamic that involves making hypotheses about change explicit, testing these hypotheses against evidence, revisiting one's change ideas based on what is learned through such tests, and testing again. Improvement research typically entails cycling through this process multiple times. By identifying key work processes, gathering data about those processes, and learning their way from small tests of change into large-scale implementation, an organization can meet its ambitious aims. The three improvement questions keep the organization focused on their destination, the very practical changes to get the organization there, while also constantly examining data as to whether they are progressing towards the outcome they cared about. Developing initiatives that achieve effectiveness reliably at scale begin with a careful analysis of the institutional context for change. Their considerations organize their analysis. First is a critical assessment of available know-how. Practitioners, policymakers, and researchers are rarely at a loss for ideas about how to make things better. However, they often lack the specific practical knowledge necessary to get these ideas to actually work. Second, advancing change at scale makes demands on both organizational capacity and human capabilities. Even if educators know how to make some set of change ideas come alive, one still needs to assess whether a sufficient number of these people exist and whether the necessary organizational supports are in place to execute at the scale envisioned. It is important to remember that the rate of spread for any effective change is a function of the size of the current expertise base that can teach and mentor others how to do this work. The third is an assessment of the politics of change. Improvement efforts need the goodwill and engagement of the people whose work is the subject of change. How are those most directly affected likely to respond? Change can move quickly when individuals are receptive to the ideas being advanced. In contrast, the presence of suspicion and resistance constitutes a major hurdle in navigating a productive improvement journey. It is especially important in these situations to attend carefully to the principle of user-centeredness. How one analyzes an institutional context in terms of these three concerns dictates the most prudent approach to follow. The common practice today is to go straight to large-scale implementation. Yet rarely do reformers operate under conditions where they truly know how to make a new idea work well, where the necessary capacity exists to execute it at scale, and where the workforce is ready to take on a new challenge. So it is not surprising that initiatives regularly fail to deliver on the promises made. There is a better way, starting with a small, rapid test of change, and then expanding the initiatives out as the improvement team learns. A set of general principles guides this approach. 1. Wherever possible, learn quickly and cheaply and deeply. Be minimally intrusive. Some changes will fail, and we want to limit the negative consequences of individuals' time and personal lives. 3. Develop empirical evidence at every step to guide subsequent improvement cycles. Doing so simultaneously advances three valued goals. First, through small tests of change, we develop the technical knowledge to turn a good idea into something that can actually be executed effectively. Second, we build capabilities among the individuals involved in the early testing. The practical expertise they develop through working out a set of change ideas becomes an invaluable resource to coach others as they learn to do the same. Third, as early adopters experience heightened efficacy in the day-to-day work, they also now become champions for these changes to be taken up by others. So starting small to learn fast also helps build will for large-scale change. To be clear, not every improvement problem must start as a very small test of change. If know-how and capacity already exist, one can begin with a large-scale test, and under the right political conditions, even go directly to full-scale implementation. The faster a network can learn, the faster it could move from small-scale testing to system-wide implementation. The Plan, Do, Study, and Act, or PDSA cycle, a basic method for inquiry and improvement research, guides this rapid learning. A PDSA cycle follows the logic of systematic experimentation, common in scientific endeavors, now applied to everyday practices. The cycle consists of 4 steps carried out repeatedly to answer new questions as the scope of the inquiry expands. The heart of the cycle is articulating hypotheses based on the working theory of improvement and then gathering data to test them. Predictions are made about the results expected. When these predictions are compared to what actually happens, gaps in understanding are revealed. Previously unrecognized but critical details about how work is carried out suddenly comes into view. Often, multiple PDSA cycles are needed to develop a change idea that actually works. Each cycle builds on what was learned in previous cycles until a team has discerned how to affect improvement reliably under different conditions. One of the advantages of the PDSA cycle is that it is a very flexible tool to guide learning at different stages, from a good idea to a quick prototype to something that may work in a few places, and finally to a robust, large-scale improvement. It is important to recognize and watch for unintended consequences. One in particular is called a balancing measure in improvement science. It comes from recognizing that when a change is introduced in one part of a complex work system, it often produces unintended changes elsewhere. Gathering balancing measures helps improvers monitor other parts of the system that are not currently the target of improvement, but which may still be affected by the change we are pursuing. Outcome measures, both leading and lagging, help define and assess what is being accomplished. Primary drivers measures inform about key intermediate outcomes that typically sit at critical junctures in the working theory of improvement. Process measures provide feedback, valuable information about how specific changes attempted in the PDSA cycle are performing part of the system that might also be changing as a result. With such a system of measures in place, each of the hypothesized causal links in a team's working theory of practice improvement can be examined. In sum, combining the PDSA methodology for inquiry with a system of practical measures provides network improvement communities with strong empirical infrastructures for learning their way into better outcomes. Beginning with a working theory of improvement and associated measures, improvement teams repeatedly test change ideas and gather evidence that continuously challenge what they think they know, what measures are actually telling them about how the system operates, and ultimately, whether the process being developed actually linked to valued outcomes. Rigorously pursued over time, this process builds towards a robust base of professional knowledge about what works, from whom, and under what set of conditions. It is important to acknowledge that engaging a diverse community of practitioners, researchers, and institutional leaders in such efforts requires everyone to think and work in new ways. Harnessing multiple forms of expertise so that they join together as something considerably more than a sum of random parts is essential for meaningful change.